Hi, everyone. Thank you so much for joining us on Facebook. It is a very fitting week to have paramedic Caitlin Tavares joining us here because, of course, it is Paramedic Services Week, and this year's theme, very fitting, pandemic paramedics on the front line. So we're talking to a paramedic who is doing just that. She is on the front line every day. Caitlin, thank you so much for joining us.
Oh, thanks so much for having me, Michelle.
So can you tell us a little bit about your background, how long you've been a paramedic for?
Yeah, so I'm a paramedic with the region of Peel. I'm an advanced care paramedic, and I've been working for Peel since 2006.
Okay, awesome. And why did you want to become a paramedic? Because I understand it's pretty difficult to get one of those positions.
Yeah, it's quite a competitive program, actually. So I always knew that I would want to work in the healthcare field. And I think the thing that really drew me to paramedicine was the challenge of working in an uncontrolled environment. I found that it was really exciting and offered a really great challenge. Obviously now, the things that I found that drew me to it are some of the things that are putting us at a bit of an increased risk right now, but that was really why I got into it.
So how has your job changed since the pandemic began? Walk me through kind of a day in the life.
Yeah, so basically everything has changed about the job since the pandemic. When people say to me now, like, what is it like out there? I think that for me anyways, the word I would use is it's weird. It's really weird out there. The thing that's changed the most is that, I've been doing this job for quite a while now, and I have this really great partner, Ryan, that I work with, and we have a really great relationship. We know, how to run a call, and like, we've kind of got it down. Since the pandemic hit, everything has changed. So the way that we do everything from the start of our day to the end of our day has changed. And mainly what that would be is just in terms of like increased personal protective equipment and things like that on calls, and really making sure that we keep ourselves safe and we keep the patients safe.
So what kind of gear do you have to wear?
Yeah, so for every single call now that we attend, we wear at minimum gloves, a mask, and eye protection. So that would be for any single person we come across for any reason at all. If we do have somebody who we have that screens positive, that isn't somebody who necessarily has COVID, it's just somebody that is exhibiting some sort of symptom that could potentially be attributed to COVID. We escalate our personal protective equipment from there. So we have the addition of a gown.
Okay, so you have a basic personal protective gear for every call. It's escalated when you have a suspected case, basically.
Yeah.
When did you think, okay, COVID-19 is real, it's here, and it's potentially going to affect my life, and I guess for you, your job as well?
Yeah, so personally, I've been hearing rumblings about it, and I've been listening to actually randomly a podcast for a guy who has been talking about it a lot. And it was coming up to the March break, and I was thinking to myself, you know what, like I really might not be sending my kids back to school after March break. It turns out the decision was made for me, but I really thought, you know what, like this seems like it's going to be a big deal, and I don't think I'm going to send my kids back after March break, so I need to come up with a plan for that. And then at work, it was my partner and I attended a call for a guy who we cover the airport with Peel.
Wow.
So my partner and I attended a gentleman who and his wife had just come off a cruise. And that probably was in early March. And he, at that time, we were really only looking at people who had come from mainland China. And this guy had come from a Caribbean cruise. And I thought to myself, and my partner and I said to ourselves, like, I think this guy has it. And he was really, really sick. And that was where I thought, man, like, if it's here, like in the Caribbean, then it's going to be everywhere. And so that was kind of my first real wake up call where I thought, oh man, this is going to be something.
And so what made you think this guy has it?
Just his symptoms. So he had a dry cough, he had a fever, and he was quite short of breath. And it had been going on for about a week now, and him and his wife both had the same symptoms.
And was that your first COVID-19 call?
Yeah, so that would have been the first one. I mean, I have no idea whether or not he ended up having it, but that was the first time that I really suspected that somebody that I had come into contact with likely had it.
Sure. Now, when you take someone who's a suspected case now to the hospital, What's that protocol like?
Yeah, so it's changing all the time, which is part of one of the real challenges that we have as paramedics. And like I talked about, that uncontrolled environment is that we have things that are changing constantly, whether it's on our own end with protocols that we do, or whether it's the hospitals that are adapting and changing their protocols. So every hospital is different, but what the typical thing that we do is usually it's, one patient in at a time. They get the story from us, things like that, and then they decide where the patient's going to go, and they take that person to that area before they'll bring in the next one. So it's a bit of a waiting game, which is frustrating for us and for the patients, but it's something that's absolutely necessary for everyone's safety right now.
Got it. Now, if you're just tuning into our Facebook Live, just a reminder, we're with paramedic Caitlin Tavares. It's Paramedic Services Week, so feel free to ask any questions. We'll try and get through as many as we can. Just type them in the comment section below and we'll answer away. Now, Caitlin, how many calls on average, specifically pertaining to COVID-19, would you receive a day? Is there a number that you could ballpark?
Yeah, so it's hard. The number of actual confirmed COVID patients isn't as high. It's like I was saying, right, with that number of screened positive patients. So those people who could potentially have it is almost every single person that we see, because the symptoms are so varied, and because we have people who, could potentially be transmitting before they're symptomatic. We really needed to really cast a wide net to keep us safe and to keep the public safe. So it is really almost every single patient that we see that is that screen positive, but not necessarily confirmed COVID.
Okay. Now, we've just got a question in from Kevin. He says, do you think the provincial government will or should make it mandatory for everyone to get tested? In your opinion, is that something that would be helpful, getting everyone tested regardless of if you're symptomatic or not?
Yeah, so I mean, in some situations, it is obviously beneficial to have everyone tested. In Peel specifically, and I know a lot of the other services are doing it as well, our paramedics are actually going into long-term care homes, and we've tested every resident and staff member of long-term care homes in Peel, and we've also gone into some group homes and family shelters and things like that, and have tested everyone there. In areas where people are contained in small areas or in small environments for long periods of time, obviously to test everyone and to find out what's happening in there is incredibly beneficial to reduce the spread. For things like frontline healthcare workers, I mean, we are able to be tested now if we need to be. To test us all would be great, but it's also difficult. I mean, I could go to work today and be negative, and I could go to work tomorrow, and the situation might be different, right? Based on who I saw came into contact with that day. So yeah, I agree. It would be great to have everyone tested. I think that especially for emergency services where we come into contact with so many people every day, it might be a little more challenging, but I think overall it's a good idea.
Have you ever had a test?
I have not been tested, no. I hear it's quite unpleasant, but...
That's what I was going to ask you about. I hear it's a very long stick that goes up your nose.
Yes, I heard it's quite unpleasant, but I have not been tested myself, no.
Now, we hear a lot of stories that are sad and negative. Do you have any stories that are maybe happy or inspirational, something you've experienced on the job?
Yeah, so I think that obviously there's a lot of fear and anxiety and things like that going around right now, and it's really easy to get bogged down in that because things are, like I said, so weird right now and so out of the ordinary, and it's really hard to see that things are ever going to go back to normal. But I mean, there has been some really, really, really wonderful moments that we've had during this. I mean, I feel incredibly lucky for the people that I work with, and every day I just really, really enjoy being with them, and they're really a great group of people. Also, we've had the most incredible outpouring of support since this has all begun. I mean, personally, I had a friend of mine whose mom baked me and my coworkers like a pile of cookies and biscotti, and it was so nice. And we have people constantly just, if we're just out in the community, thanking us and telling us to stay safe. And it's just been the most incredible outpouring of support. And I think that that's just been it's just been really, really wonderful.
Well, listen, you deserve it. You're putting yourself at risk. You're brave. You're putting yourself on the front line. I think it's safe to say that you deserve a few biscottis. Now, how does it feel for you to be called a healthcare hero? Because you are.
Well, I think, like I said, I don't speak for every paramedic, but I think that for the most part, we have historically been a little bit uncomfortable with that term. But in going through all of this and having that talk of like this healthcare hero thing, I think that, I mean, I'm a little more comfortable with it. It's true. I mean, some of us say, well, this is the job we signed up for. And it's true in a way, it is the job we signed up for, but also none of us signed up for this, whether or not you're a paramedic or you're working in a grocery store or whatever, or you're working from home now, no matter what it is, none of us signed up for this. So I think that in a way, we're all heroes for whatever part in this that we're playing. So I'm more comfortable with it for myself now because I'm also, very much willing to give it out there to everyone who's doing their part throughout this.
Absolutely. Now we've got another question here. This one's from Neil. He says, what is the spirit like among other paramedics? How are they feeling about working on the front lines?
Well, I think initially it's that unknown, right? It was all very scary and things were changing every day. And there were so many things that we didn't know yet. So it was very scary, to be honest. The first patient that I had who was, that COVID positive patient, I remember sitting in the back with him. And if you've ever been in the back of an ambulance, it's not a big space. And I remember sitting in the back with him and I just had this overwhelming thought of, it's in here. Like, it's in here with me in this small space. And it was a really, really uncomfortable feeling. So I think initially it was that fear and the unknown. But as we've been going through it, and like I said, it's becoming, a part of our new normal. I think that the spirit has really, really started to lift. And, like I said, all those people who have, written us letters or said things to us on the street or sent us, lovely goodies, has really also helped. And just knowing that everyone's really there to support us has really, really helped lift morale and keep us going.
Okay, another question from Andrew. He says, do you feel like you and the team were prepared for a pandemic?
Yeah, that's a great question, actually. So I would say yes and no. As paramedics, we are used to working in kind of the unknown all the time. So we're always ready in terms of personal protective equipment and we're ready to use it. We've been using it a lot and we are very, very comfortable with it. I think initially there was a lot of unknowns from everyone about what this was and how it moves. And so I think no one was really prepared for what that meant. But as we've gone on, we've all figured it out. And I feel, very lucky where I work, especially in the region of Peel. We've had, a good supply of PPE the whole time. And we've actually implemented, it's called a high risk response team. So it's a group of paramedics who have a little bit of extra training and they come out to those calls where we are at an identified higher risk of transmission, and they will come out and assist us on those calls and do those procedures that are the higher risk ones. So that's also really nice to have.
So would that be like a long-term care home, for example? Would that be?
It could just be really anyone where we have to do for the most part, like advanced airway procedures and things like that, where you have a high risk of transmission, and they'll come out and they'll actually do those procedures for us at this time, which is really great. It keeps us safe and it helps keep the public safe as well.
Perfect. Well, if we don't have any more viewer questions, I think that's probably it for us. And I just wanted to say on behalf of our 680 and City team, and I think it's safe to say society at this point, thank you for what you are doing. You really are a hero and your bravery is inspiring, and we couldn't do this without people like you. So Caitlin, thank you.
Thank you so much for having me, Michelle. And thank you to everyone out in the community who is doing their part throughout this to help support us and everyone else. And I would like to say happy Paramedic Services Week to all my fellow paramedics. I'm honored to work alongside you every day.
Wonderful. All right, we'll wrap it up. Thanks so much.
Thank you.
Bye, Caitlin.
Bye.